Hey everybody, it's Kim. This week my presentation is on lung cancer. I'm just going to start with a little pathophysiology. Lung cancers come from the epithelium of the respiratory tract. Because of this, tumors such as mesotheliomas and sarcomas are actually excluded from the category of lung cancer. Lung cancer is also referred to as bronchogenic carcinoma because it arises from the cells that line the bronchi in the lungs. There's two types of lung cancer. There's non-small cell lung carcinoma and small cell lung carcinoma. Non-small cell lung carcinomas include squamous cell carcinoma, adenocarcinoma, and large cell undifferentiated carcinoma. Non-small cell lung carcinoma accounts for over 80% of all lung cancer, and small cell lung carcinoma makes up over 15%. It's estimated that 155,870 deaths in 2017 will be due to lung cancer. 1 in 4 cancer deaths are associated with lung cancer, and that makes this the leading cause of cancer death. The most common type of lung cancer is adenocarcinoma, making up approximately 35 to 40% of all bronchogenic carcinomas. The most common cause of lung cancer is active tobacco smoking. It's estimated that a quarter of lung cancer in never smokers can actually be attributed to passive tobacco smoking. Some other causes of lung cancer would be genetic predisposition and exposure to cancer-causing agents such as benzopyrene, which is a chemical found as a result of things such as wood burning, coal tar, and diesel exhaust. Exposure to radon gas, and that's a natural breakdown of uranium in the soil, and asbestos exposure. Just to reiterate, the leading cause of lung cancer is tobacco smoking. Treatments for lung cancer generally are going to be surgery, chemotherapy, radiation, and palliative care. Surgery to remove cancer is just one option. It generally includes wedge resection or removal of a small portion of the lung, segmental resection, which would be removal of a larger portion but not the entire lobe, lobectomy, which is the removal of an entire lobe, and pneumonectomy, which is the removal of an entire lung. Chemotherapy is another option, and it's usually coupled with surgery and started after surgery. Radiation is another option, and that's also generally used in conjunction with surgery and chemotherapy, but sometimes as a single option for cancers that can't be removed with surgery, and sometimes as a first treatment for small cancers. Palliative care efforts are also important to help with the side effects of cancer treatments. That would be things such as pain management, nausea and vomiting management, depression treatment, diarrhea and constipation management, and fatigue treatment. Although it does address the side effects of other treatments, sometimes it is the only treatment that a patient will choose. My case study is a 55-year-old Asian female that presents with mild shortness of breath, intermittent cough, fatigue, and weight loss, which has progressed over the last 3 months. She was previously seen in an urgent care clinic and given a cough suppressant, benzonatate, and albuterol inhaler to use as needed, and was advised to take ibuprofen as needed for pain or fever. She reports little relief with the benzonatate and albuterol and has never needed the ibuprofen as she's not had any pain or fever. No chest x-ray was performed at the urgent care clinic, and she's come in to be seen today because the symptoms are persistent and getting worse. She denies any smoking history, but she does report she's been exposed to secondhand smoke from her spouse for over 25 years. For diagnostic testing, a chest x-ray was performed and shows an irregular roundish light spot in the upper right lung. You'll see that here in this x-ray here. Because of that finding, a bronchoscopy was performed, a biopsy was taken, and the cytology report shows EGFR mutations, which are consistent with adenocarcinoma. EGFR is the epidermal growth factor receptor. A CT was then done just to check for any obvious metastases, and none were found. And the diagnosis was adenocarcinoma, which was found to be localized and staged at T1N0M0. Treatment for this patient, she did decide on surgical resection of the tumor with just the wedge removal being appropriate as the tumor was small. Following the wedge resection, she began treatment with Iressa, 250 milligrams PO daily, so that is an oral chemotherapy agent, and that's an EGFR tyrosine kinase inhibitor, and this type of oral chemotherapy targets the EGFR cells to prohibit growth. Palliative treatments include antiemetics, analgesics, and bowel care, and then additional treatments would be evaluated based on need. She would need a dietitian consult to follow her for her nutritional needs and then weight management. Weekly labs would also need to be performed to monitor liver and kidney function, as they can be highly affected with the chemotherapy. That concludes my case presentation. Please let me know if you have any questions. And briefly, here are my references. Thank you.